we're looking at taking what we're learning with Project Access and then the Jesse Tree model and trying to do and implementing them together. So actually Ted Hanley, Director of Jesse Tree, and Alan McKenzie, Director of Project Access, are very excited about that possible approach.
And in talking with Ted Hanley, he believes that there's a lot that we can build off of the development work that they already did on the IS system. The ability to automate referrals and to track them, which seems very much in line with kind of where we're going with our IS development.
Is there a way that we can start really pulling all these together? And that's where personally it really excited me, because I see all those linkages as part of the 100% Access project.
So we're able to take something that felt predictable, because these communities have been able to achieve some of the outcomes that we were hoping to achieve, and make them bigger than they were on their own by blending them together in a unified strategy. Where Communities Joined in Action really helped us, it actually builds towards a larger national movement where people get recognition and feel like what they're doing is part of something greater.
The challenge for our project, as for others around the country, would be to integrate best practices and add our own variations to the mix.
The group I was working with never thought they could get a federal grant, a $400,000 grant. I mean, it just seemed unthinkable. And sure enough, we did. And now people are learning that we're part of the national environment, we're part of the state environment, we're very much part of the local, regional environment.
From a faith-based perspective, I'm saying love your neighbor, take care of everybody, nurture them, meet their needs. From a healthcare perspective, they're saying manage that disease, keep them out of the ER. From an economic standpoint, the legislators are saying, quit spending those Medicaid dollars, save that money. My job is to figure out how we get everybody to the table.
In this day and age when there's so little money, everybody wants to put the money into direct services, and by God, most of it needs to be there. But if you eliminate the ability of communities to sit down and do this work, you miss out on some of your best, most cost-effective strategies that allow you to increase capacity in any number of ways, as well as find innovative solutions to community problems.
I try to use what we learned. We've served about 16,000 people in our regional access program. Take those stories, have them add up to something, make sure that these people don't get lost as we think about the future, and then also to use the patterns that we see across those 16,000 people to help us build a better system.
I do believe we'll find the best solutions that fit our communities if we can do this locally, and if we can communicate with each other readily and easily about best practices, about new ways of doing things.